Thank you for joining us here on KMR Local 4 News. The city of Amarillo is preparing to have a briefing about the current coronavirus pandemic. We'll take you live for this breaking news.
Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Michael Lementier, Chief Medical Officer for BSA. Dr. Sumay Mawad of the Amarillo VA, and City Manager Jared Miller. At this time, I'll turn it over to our panel to give some brief statements before we take questions from the media. I'll go ahead and turn it over to Amarillo Mayor Ginger Nelson.
Good morning, Amarillo. This morning, I want to start by visiting a little bit about the budget. We are going to be receiving, actually, we've already received some coronavirus relief funds from the state of Texas that were fed from the federal government. So Amarillo will qualify for funding at $11 million. And that's calculated on a per capita basis, $55 per capita. So that's 55 times 200,000 gets us $11 million. The state funded 20% of that just outright. So we have already received funding of $2.2 million to be putting toward our coronavirus response expenses. And so far that's covering our expenses. We will also be qualifying for more money, up to $11 million on a reimbursement basis. So as we need to respond, whether that's testing, PPE, extra staffing to do contact investigations, all of those things would be the type of expenses that would be reimbursable using our CRF Coronavirus Relief funds from the state. So I want all the citizens to be aware that we're getting that funding, and we are having conversations not only about that funding, which has already come, but about any additional funding that might come as a relief to taxpayers by helping us cover shortfalls in our budget. We're not having conversations about increasing property tax. I'm starting to see some things in the media. I know Governor Abbott is encouraging local officials not to raise property taxes. And while I'm only one of 5 people on our council that would make that decision, I'm not hearing anything in the staff or any of our council conversations during our city council meetings that are leaning toward thinking we would close any budget shortfalls by raising property taxes. I don't think that's who we are here in Amarillo. What we do have, though, are some very real budget shortfalls as a result of the coronavirus impact. And so I want to talk just a minute about what we're going to do to try and address those. Hopefully the federal government will give us some relief. They've given relief to individual taxpayers. They've given relief to business owners with PPP loan programs. And I'm very hopeful that they'll recognize that local governments have shortfalls in their budgets, and perhaps we would get some federal stimulus dollars to address those shortfalls. Other than that, our budget is going to be hit through sales tax revenue reduction, through hotel occupancy tax that we use to fund the Civic Center and some other things. We have to be conscious of watching where our revenue is going to go down, just like all of us. Every citizen is watching their household budgets as revenue goes down, whether you were able to work or not during this crisis, and whether or not your expenses have changed. Everyone's looking at their budgets, and the city's no different than that. So what we don't want to do is fall short. That's not an option. So we're right now looking to cut expenses so that we can save cash, hold back, and make sure we know that we are going to be on track for our budget this year. We are a very fiscally conservative city. That's something that we value, and all of the city council values that. So we've been talking about our budget needs and places that we need to consider cutting back, especially this summer as our short term, and we're closing in on the backside of our budget for the fiscal year. What can we do to save dollars by the end of our fiscal year? One of the ways that the staff is proposing that we save dollars is to limit our summer programming. So there's been some conversation about whether or not we're opening the swimming pools, the 2 outdoor swimming pools that we have. And I want to just talk about that, address that for a minute. Financially, it's expensive to open those pools. They've been winterized, and so to get them up and running is a a significant financial cost to us as taxpayers. I think it's usually worth it because we like the quality of life and the activity for our kids. This summer, though, due to budgetary constraints, we just don't have the dollars to open those pools. And that's disappointing. And I do think it would be great for kids to have that activity this summer. But the reality is we can't fall short on our budget. And this is one of the programs that we need to cut in order to meet our budget constraints as a result of COVID. So while the pools won't be opening, I'm talking about the 2 outdoor pools. There is a difference in the one facility that the city owns that is an indoor facility. It's a gym, it has a computer lab, the Warford Center, and it does also have an indoor swimming pool. That facility is a year-round facility. It's open all the time. And so it did close when when our shelter-in-place order went in. But to open that pool it's very simple. There's no costs involved in opening it because it's already open. It's open year-round. It's staffed. So, 100% of our indoor facilities like that are going to be open. It's our outdoor facilities where we have hard costs to get them up and running, and they only run a limited time of the year, which means we subsidize them. Those pools don't pay for themselves, despite the fact that people pay to use them. The city has to subsidize the operation of them substantially. So I just want to get that information out there. So anybody who has questions about why the Warford swimming pool is opening, but our 2 outdoor pools aren't opening, there's just a substantial difference in what it takes to operate from a cost point of view and to get those outdoor pools up and running. A couple of other reasons on that: staffing, and I'll let Jared speak to that because they're very operational, and just the safety of operating any pool, which the governor has spoken to also. I'll save that for Jared to comment on. But I do want you to know as citizens that this will have a budgetary impact on the city, just like it has had probably on your household and your family. And we're managing that in the moment, trying to pivot and respond to it in a responsible way. I am proud to report that our city was recently reevaluated on its bond rating. And despite the fact that we have uncertainty in our revenue, we were able to hold our bond ratings, which saves us a lot of money in the long run and puts us in a very unique category as a city. We're in the upper echelon of cities who are financially responsible enough to be rated as high as we are. And I'm very proud of that. And that's been decades of leadership inside our staff in our financial departments, valuing that and doing all of the work diligently that's required to keep those. So my report this morning is more financial related than it is specifically to COVID, but that's all information that I wanted citizens to have. Thank you, Dave.
Thank you, Mayor. At this time, we want to go to Public Health Director Casey Stoughton.
Good morning. As of yesterday, there were a total of 2,809 cases of COVID-19 reported in the Potter and Randall County area. 2,193 cases in Potter County and 616 cases in Randall County. We've had a total of 506 recoveries, and we're excited about each and every recovery. There have been a total of 29 deaths reported in our county, and we're sad for each family. That leaves us with 2,274 active cases in our community. Amarillo Public Health and Amarillo Fire Department are working together along with nursing homes to comply with the governor's order to test all staff and residents at nursing homes. Once those results begin to come in, we anticipate another increase in results from testing a large number of individuals. This information will be helpful to each nursing home so they can coordinate the care of individuals while slowing the spread of transmission in their facility. I also want to remind everyone that slowing the spread of COVID-19 requires us to go back to the basics. We must practice good hand washing, wear a mask in public, and stay 6 feet away from others. These practices will help keep ourselves and our loved ones healthy. If you're sick, please call your doctor. Stay home unless you need to seek medical care. And if you're experiencing symptoms of your chronic health condition, please reach out to your doctor. If you're well, please consider donating blood with Coffee Memorial Blood Center. We've got lots of resources here in our community, and we're excited to share each of those. Thank you, Dave.
Thank you, Casey. And this time, we want to go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Sorry, Dr. Milton, we got you.
Oh, gotcha. Okay. All right. So I just wanted to say briefly that we are still evaluating patients for remdesivir at the hospitals, and that seems to be going well. And thus far, we have distributed to 3 patients, and we have several more that we're looking at. And that's all I have to say, Dave.
Thank you, Dr. Milton. This time, we're going to go to Dr. Brian Weiss, Chief Medical Officer, Northwest Texas Hospital.
Great, thank you. Good morning from Northwest. So I know we continue to be in the national news due to the number of positives we're getting in the Panhandle, but thankfully that is not equating into an increased number of hospital admissions. In fact, it's actually the opposite. At Northwest, we saw our peak on April 30th. And ever since then, we've seen a downward trend. And in fact, over the last 10 days, we have seen a reduction in the number of hospitalized COVID-related patients by 1 to 3 patients a day. So today, for instance, we are at 26 positives, and we have 3 PUIs in-house right now. Now, out of those 26 positives, 8 are in the ICU, and only 5 are on ventilators. So we are using 7 of our 40 ventilators right now, total-wide in the hospital. So again, showing that we have still a lot of resources. We have had 18 mortalities at the hospital, and again, our hearts and thoughts go out to the families of those individuals. As Dr. Milton said, we have given 3 doses of remdesivir or treatment under his guidance. Certainly one of those patients appeared to have had a very positive clinical response from receiving that medication. So we continue to evaluate patients very carefully for that limited resource. We are seeing increased volumes in our emergency room of non-COVID related issues, which is great. Right? This month is trauma month, this month is stroke month. So I ask people to take advantage of all the education from different sources on how to keep yourself from being traumatized, and second, what symptoms to look for if you are having a stroke and need to come for medical attention, because we do want to see people coming early for those needs so we can help them as quickly as possible. We are in our 2nd week of elective procedures at the hospital. We are testing every individual that's coming in for any kind of elective procedure, and certainly if anyone's positive, we will postpone that procedure until they can get past their positive state. I guess with regard to the lower numbers in the hospital, we've been able to catch up on our PPE, so we're really in excellent condition right now on the personal protective equipment we have in the hospital. And lastly, we are continuing to keep in place our visitation limitations right now. That may change the next few weeks, but for people who come to the hospital, please know we're not allowing visitors to come with people coming for surgery at this time. So that's all I have from Northwest. Thank you.
Thank you, Dr. Weiss. Now I'll go to Dr. Michael Lementier, Chief Medical Officer, VSA.
Good morning. Thanks for letting me join the conference today. I think that I share some of the same themes that Dr. Weiss mentioned today, and I think the critical thing here to say is that despite the large number of positives that we've had reported for Amarillo, the inpatient census at both hospitals continues to slowly decline over the past week to 10 days. Our peak at BSA was a little bit later than Northwest. We peaked on May 8th with 54 positive cases confirmed and hospitalized on that date. Since then, we've had a steady decline. It's definitely a trend downward. We'll have a day where we bounce up by 1 or 2 cases on the inpatient side, but the trend is definitely downward. Today, we have 28 patients that are in hospital confirmed. We've had a little bit smaller percentage of those require intensive care services, down to 11 today. And of those 11, only 7 of those are on the ventilator. Interestingly, our overall inpatient census today is the highest it's been as far as our average daily census since the beginning of this pandemic back in early March. We're up to 280 patients in hospital today. So it is not surprising that the bulk of the patients that we have in the hospital today that are on ventilators are not COVID patients. They're here with different illnesses and other things that we typically see that oftentimes can lead to respiratory failure and require mechanical ventilation. So again, that's kind of where we stand. We still have plenty of capacity as far as the ventilators go. Our ICU capacity at times has been significantly elevated. It is down at this time compared to where we were on our peak COVID census. and we're closer to that 78% range. But we have adequate capacity with our surge plans that we've been working on now for a couple of months and put a lot of time and effort into to ensure that we're providing adequate hospital capacity for our patients in the Panhandle. I'd like to add that we have tested now over 2,000 patients total through BSA's laboratory services and also the send-outs that we've done since the beginning of the pandemic, and we've remained in that kind of 21% range of all tests being positive. The bulk of those cases were obviously in the outpatient setting. We have, as of this week, admitted over 180 unique COVID patients since the beginning of the pandemic, which is a large number of patients that we've had to take care of on the inpatient hospital side. We're much better positioned now with our personal protective equipment. We've had significant help from outside vendors and resources, including our local state support, which we're very pleased with and happy about, and we're very appreciative of. We now are also in a far better position with our rapid PCR testing kits. We're still using a prioritization strategy to make sure that the inpatients get the greatest opportunity to have that test because of the need to turn those tests around quickly. More stable patients, we're using the services through our Lubbock and CPL laboratories, which have been very good as far as their turnaround times for us as well. So we're happy about that. From a preoperative testing and procedural standpoint, we have been moving forward under the guise of the governor's executive order and how that's been morphed over the past several weeks. We do have a preoperative testing protocol that has been, we think, very effective. Less than 1% of the patients that lead to testing with our pre-op protocol are coming back positive. And we've done a large number of tests to make sure that we're trying to be as fastidious as we can with not having someone go to surgery unknowingly that is COVID positive, but asymptomatic. There's still, folks, is not a lot of good data about this category of patients, but with the limited data that we have, it appears that if someone does go to a procedure and is unknowingly positive, there could be issues. So we're trying to be very diligent about that, just like our partners and in the Amarillo community, Northwest, are doing with their patients. So again, I think that it's critical for us to continue to maintain our ability to continue to socially distance as much as possible, continue to be kind to your neighbors in terms of masking in the public setting. Please continue to come to the hospitals when you are having acute illnesses that warrant hospital evaluation. You're not doing yourself or your family any benefit by staying home having unstable angina or cardiac chest pain, I should say, or having worsening respiratory status because you have chronic lung disease. You need to be evaluated. You could have more grave consequences than you would with the very, very slim chance of you acquiring COVID in-house. And to this date, we haven't had any patients that we are aware of and have tested that have had hospital-acquired COVID. I'm not aware of any patients like that. So I think we need to be cognizant of the fact that the hospitals are doing a good job of keeping those patients separated and isolated and protecting staff. So again, that's my update for today, and I appreciate the time.
Thank you, Dr. Lementier. This time we're going to go to Dr. Moet of Amarillo, VA.
Good morning. Thank you, Mayor Nelson and the City of Amarillo Public Health Department for giving me the opportunity to speak to our veterans and their families in the Texas Panhandle. Also, I want to thank you for giving Amarillo VA healthcare system the opportunity to participate in our collective efforts as a community in combating coronavirus disease 2019. As of this morning, Amarillo VA healthcare system has 0 positive patients in our hospital. We have 4 recovered patients, and we have been monitoring 9 positive cases that are self-quarantined at their home. An additional 3 PUIs are on home quarantine. We currently have 1 positive staff member among our staff and no PUIs among our staff. I want to say remdesivir, the antiviral medication that was made available to our veterans by the Veteran Health Administration, has shown proven efficacy in terms of improving the clinical course and reducing hospitalization bed days when we used it in treating our veterans. So I see it as a very promising medication for COVID-19. As we all know, many Americans' employment, to include some of our veterans, have been negatively economically affected due to the coronavirus 2019 pandemic. I want to encourage our veterans who may have a concern about accessing health care or who may think that their eligibility for VA care may have been changed due to a change in their employment status, to contact our business office, because we will be taking care of all of our veterans who may have been negatively economically affected by this crisis. For questions or concerns about accessing VA care, please call our business office at 806-355-9703 or 800-687-8262 extension 729. 800-687-8262 extension 729. I also like to announce that as part of the Department of Veteran Affairs Force Mission, our hospital doors are open for all citizens and residents of Amarillo who may need hospital care for humanitarian reasons, free of charge. That include any of about 17% of the population in Potter County who are uninsured, and 9% of the population in Randall County who are uninsured, according to statistics obtained from Johns Hopkins University. We have a surge plan that include nurses, providers, beds, ICU beds, and ventilators. So if we are called upon as the VA to provide care for some of our indigenous people or people who are uninsured, we have a plan and we will be more than happy to help our community. Last, I want to take a moment of silence to honor our veterans across the nation and all of our fellow Americans whom we lost in our battle with this disease. As we come up on the Memorial Day weekend, I know that Memorial Day holds a special meaning for many of our fellow Americans and for our veterans who lost loved ones or fellow brothers and sisters in arms. I want to remind our veterans that we will have same-day access for mental health services available by just calling 806-355-9703, option 2, 806-355-9703, option 2. Thank you.
Thank you, Dr. Muller. This time we're going to go to City Manager Jared Miller.
Thank you, Dave. I also want to say thank you to Dr. Muller for the moment of silence in recognition of Memorial Day and for those veterans who were lost to COVID-19. I appreciate that. Public safety calls seem to be trending down toward a more normal average. Today's calls are as follows, or trending toward a more normal average. Amarillo Police Department's up 12% versus this time last year. Amarillo Fire Department's up 2%. AMR, our ambulance service, is up 12% with regard to last year's calls. At the same time, we are experiencing a decline in COVID-related responses. The city operates a COVID-dedicated fire response vehicle, as does the AMR ambulance service. And we're seeing a decline in calls for those vehicles. The uptake in our call volume is due to the nicer weather we're experiencing along with the approach of Memorial Day and the start of summer. As a reminder, we recently announced a new emergency notification service to provide current and factual information on a variety of events, including COVID-19. We encourage citizens to continue to sign up for the service at AmarilloAlerts.com so you can stay informed. As of this morning, we have 6,308 people signed up for these alerts. Also, as a reminder, the drive-through testing center remains open. If you feel sick and have symptoms you think may be COVID-19, call the public health hotline at 378-6300 to be screened for the drive-through testing center. We're reopening a number of city facilities, and we're doing that in a phased manner. This week, we began the process of updating public access policies related to COVID-19 for specific city departments. The utility billing department is accepting walk-ins at Amarillo City Hall while adhering to social distancing policies. Utility billing, excuse me, and vital statistics customers may also utilize curbside payment services. Customers wishing to utilize curbside service should enter City Hall parking lots from Buchanan to leave payments in the drop box, and from Johnson Street to pay by credit card. While the curbside service is currently available, we're going to continue to evaluate that and continue to offer it as long as demand warrants. The building safety department is open, and walk-in customers are allowed to come in. We're following social distancing policies at the Sims Municipal Building where building safety is located. Amarillo Public Library locations are open with social distancing policies in place. The Warford Activity Center, as the mayor said, is open with social distancing in place to ensure safety of all patrons. As earlier reported, the city canceled many of our seasonal activities, including outdoor pools and recreation programs, due to COVID-19 financial impacts. However, since the Warford Activity Center is not seasonal and it's open throughout the year, the staffing and funding were already in place, allowing it to open as permitted by the state. The city's worked hard. We've worked really hard to reopen as many services as possible to the entire community. We look forward to serving our citizens. All other city departments, excuse me, will provide in-person availability by appointment only for the current time being. Please call individual departments to schedule an appointment. City staff will continue to be available for information by phone and email. Now, I also want to give just a real brief update on the changes to the governor's latest executive order that went into effect Monday. This order is GA-23. GA-23 will continue until June 4th. We'd already, there are no changes to the essential services. There are no changes to the religious services that were already either required or allowed. And as well as the things that were allowed in phase 1, those will continue. So the retail services provided through pickup, delivery by mail, delivery to the customer's doorstep, in-store non-emergency retail services allowed to open it up to 25% capacity, dine-in restaurant services, movie theaters, shopping malls, all up to 25% of their capacity, museums and libraries, golf course operations, wedding venues, cosmetology salons, hair salons, barbershops, nail salons, tanning salons, swimming pools, up to 25% capacity, non-critical services offered by office workers, non-critical service manufacturing services and gyms and exercise facilities, all again allowed to open it up to 25% capacity. Effective May 29th, for Randall and Potter counties, massage establishments will be able to open. Tattoo studios, piercing studios, hair removal services, hair loss treatment and growth services, child care services, all will be able to open. Effective May 29th, but 7 days behind the rest of the state, in Randall and Potter counties, dine-in restaurant services are going to be able to expand to 50%. Bars and similar establishments will begin to be able to resume service at 25% of their capacity. Aquariums, natural caverns, similar facilities, excluding zoos, will be able to open it up to 25% of capacity. Bowling alleys, bingo halls, simulcast racing, rodeos and equestrian events, all at up to 25% capacity. Drive-in concerts will require customers and attendees to remain in their vehicles. And then amateur sporting events will be able to resume. However, there are extensive requirements for participants in those events, as well as no spectators being allowed. Starting May 29th for all counties in the state, outdoor areas of zoos are going to be able to open, so that will affect us at up to 25% of their capacity. Starting May 31st in all counties, professional basketball, baseball, softball, golf, and tennis, football, car racing events with no spectators are going to be allowed. Youth camps and youth sports programs, they'll be able to start practicing, but not having competitions until June 15th. Finally, Dave, you still got me?
Yes, sir.
All right. Finally, people shall avoid visiting interactive amusement, video arcades, amusement parks, water parks. People should not visit nursing homes. That's been in place for some time. Beginning June 1st, public schools are going to begin to be able to have summer school classes in the facilities with students and with teachers. Private schools and institutions of higher education will be able to reopen their campuses, and they're encouraged to follow the same standards and policies as the public schools. Finally, environmental health and the Fire Marshal's Office will continue to monitor for compliance to the governor's executive order. That's all I have, Dave.
Thank you, Jared. This time we're going to open it up to questions from our media. If media has a question for individual.
And all right, we'll continue with the coronavirus coverage on air and online. For more updates, you can go to myhighplains.com and follow us on Facebook. For now, we'll send it back to programming.
Some of these openings for us, Panhandle. I'm sure they're much appreciated. I am curious if, from the city's point of view, and really from the medical point of view, even with a week's delay, are you concerned, given the fact that all data we're looking at now is technically probably 2 to 3 weeks old, because that's how long it takes to start noticing your symptoms. So we won't know the results of this partial reopening really for probably early June. So is there any concern this may be too soon to reopen bars and all the things that are going to reopen starting next week? Whoever wants to take it.
So I would comment that my concern has lessened over the last 2 weeks or so. I remain concerned, but it seems like the trends are headed in the right direction. And, you know, the most important thing here is to continue to practice social distancing as we open up. I do think just because there's going to be more individuals out and about, we'll see more cases. But I think that in response to the question, as I said, I think that I'm less concerned than I was 2 weeks ago.
Yeah. Roger, I would say from the hospital perspective, I would say that the reality has been encouraging, but the potential is still concerning. And I think as we get, as Dr. Melton said, as we get more and more positives, there still is that possibility that we will see a surge in the next week or two from a lot of these positives we're still getting from the meat processing plant. So that's why we're not quite letting our guard down yet, even though it has been encouraging what we've seen the last couple of weeks.
I would agree with that as well. I mean, as physicians, we're designed to be concerned. I think that was like day 2 of medical school. Worry about your patients, worry about worst case scenarios. But kidding aside, I mean, I think the trends are positive. And yes, we're always worried about whether we're going to have another, recrudescence of incidents of disease here. But bottom line is we've been preparing for a couple months for this. So I think we're in a far better position today than we were a couple months ago to say, if we have another surge, what will we do? I mean, we really have been drilling on this. So I feel good about that aspect.
And we know what to do. The prevention is there. So if we can wear masks, we can wash our hands, and we stay 6 feet apart. Even in the reopening, we know what those prevention messages are. So I think that's the key, even in opening, is to stay diligent with those prevention methods.
And I concur to this statement. As we move to the future, we have a surgery plan, and some of us did not use the surgery plan at all, and I hope we will not need to use it. But we are moving to our new normal, and we, as a community, will be successful in doing that based on the hospital capacities and everything we're doing, and Casey and her work in public health as well.
Thank you, guys.
Thank you, Roger. This time, let's go to Aaron Langston, KMR Channel 4. Aaron, how are you? Good.
Good.
No, not that have been reported to me.
So I think there's around 14 nursing homes or so, and the fire department, so we're working with each of those facilities. And so the fire department has done a wonderful job at collaborating with our team. And we want to be effective, but also have the least amount of, I don't want to say the word intrusion, but the least amount of impact on the nursing homes, because that's people's home. And so we want to make sure that we do this respectfully and with the least amount of activity that has to be. And so we've been able to work with each of the nursing homes and give them the option. Do they want the firefighters to come in and actually do the test, or can we support them in their staff testing their residents? And many of the nursing homes have chosen that option, that they want to be able to test their residents because they're familiar with their residents, and there's a lot of trust there because they care for them daily. And so we've been able to work with them, and that's the option that many of them have taken. And so our firefighters are working to help make sure that supplies are available and that they're taking the specimen to the lab and those types of things. We do have a couple of nursing homes that have chosen the option that they would like the firefighters to come in and test the residents. And so I don't have an exact number because we're testing all of the residents, all of the staff and contractors. And so that number is kind of a moving target right now, but we will have, once results start coming in, then we'll be able to communicate that information. So that would fall under the jurisdiction of the Texas Department of State Health Services, and they're assisting those facilities because that would be their jurisdiction.
I would just say at Northwest, we have typically about 40 potential ventilators available. Right now, we have 7 vents totally in use, only 5 of which are being used by COVID patients.
Yeah, our vent utilization numbers are a little higher than that. We have 23 patients on ventilators right now, but that's right now only about 66% of our capacity. We have a couple of ventilators that are undergoing some maintenance that should be back up in service very shortly. And that does not count, as we've said before, the surge capacity of things that we can use as ventilators, like anesthesia machines and BiPAP machines, that we're not even talking about those devices, which significantly augment our capacity.
At the VA, since we don't have any COVID-19 patient in-house, we don't have any COVID-19 patient on ventilators. And if any of our sister facilities in the community will need some of our ventilators, will be willing to lend.
Thank you, Aaron. This time we'll go to David Gay at the Amarillo Globe News. David, how are you?
Good. Can y'all hear me this time?
Yes, we got you.
Oh, fantastic. Good to hear. So I guess the first question is actually for Casey. Regarding the testing at the Tyson plant, have all those results come in, or are they still kind of trickling in for those results?
So we do have all of the results that were done at the mass testing event. There are still some employees that need to be tested that weren't available. And so, again, information is kind of, it ebbs and flows. And so we're still able to test those individuals who need to be tested through the drive-through testing center.
Okay,
but
so
yes, all of the test results are in through that were done by the Texas National Guard.
Okay, so on that note, is there going to be a time when the split between symptomatic and asymptomatic can be discussed, and those specific numbers are given during this conference?
So that information wasn't collected by the National Guard, and it wasn't shared with us. And so as our team are working through contact investigations, it will take us time to tabulate and collect that data. And so we will, but it will take us time to do that.
Sure, absolutely, absolutely. And I guess the next question I have is for Dr. Lamentier. You talked about, the increase in the amount of people in the hospital. Could this be due to possibly people, I guess, being more comfortable coming to the hospital? With the I guess the number of COVID patients in the hospital going down?
Yeah, I mean, I think that's absolutely a partial impact there. I mean, I think as folks in the community realize that we are segregating the patients that have COVID onto separate units so that we're able to keep staff and their workflow much more seamless in terms of how they get in and out of their PPE, so that we're also able to diminish the risk to multiple other staff members and other patients. And again, as I mentioned, we've had some staff that have been infected with COVID, taking care of COVID patients. And every time we do that, we learn something and we figure out what we should be doing or could have done differently to protect someone. But as far as patients acquiring COVID in the hospital, that has not happened if they've come in without that infection and disease. So I do think it's a reflection of people getting more comfortable. People need to come to the hospital when they have a hospital concern, if you will, or a diagnosis that needs hospital care. Otherwise, the risk for their own morbidity, which means significant illness, is going to be that much higher.
And have you seen that same trend at your hospital as well, Dr. Weiss?
Yes, we have, actually. I agree with Dr. Lamentier. I think COVID-19 is going to be part of the new norm that Dr. Mowat referred to. Hospitals have always cared for patients with dangerous and potentially contagious infections. This is going to be yet another one. So I think it's just up to the hospitals. We've learned a lot of lessons. I think we've been very effective in eliminating exposure of staff and other patients. So absolutely, I think we all want people to realize and to feel very secure that when you come to the hospital, you will be protected and taken care of appropriately for whatever brings you to our facility.
Absolutely. And the last question I have is for Dr. Melton. Has the city received any information about an increased number of remdesivir coming to the community?
I'm not aware of, no, I have not received any information about that.
Okay, that's all the questions I have. Thank you so much.
Thank you, David. This time we now want to go to Ariana Martinez of News Channel 10. Ariana, how are you?
Good morning, everyone. I was wondering how the COVID-19 testing is going at the Walmart testing sites, and if those results will also be included in the city report card.
So any testing that's reported to public health will be included in the report card, and negatives and positives are required to be reported. Many times negatives aren't, but positives are always reported to public health. And so if someone resides in Potter and Randall County, then that number will be included on our report card. If they reside outside of Potter, Randall County, it will be included on the Texas Department of State Health Services information. So yes, those numbers will be reported out. We haven't, to my knowledge, received any reports yet. So we can certainly follow up with Walmart and see how that testing is going, but I haven't heard yet how it's going, but I hope it goes well. I think it's a great resource that we have in our community, and so we encourage people to use it.
And
I just want to step in for a minute, Ariana, and say, because I've had citizens asking about that, to clarify that we really don't get reported negative test results. And that makes sense when you think about it, because we are the infrastructure of the taxpayer dollars that pay for public health want to know if someone is sick. They don't really want to be paid to administer people who aren't sick. And so the system itself is set up to receive positive test results, and everyone follows through with that because they understand the value to the community of keeping us safe by communicating about positive disease spread. But we don't receive information. We don't have good numbers on every test that's been conducted if the result was negative. And so our report card mostly reflects all of the tests that we've conducted at the drive-through testing facility, plus all of the positive results that have been reported to us. Is that right, Casey?
Yes, and in the total numbers, we report all of the tests that have been reported to us. We know that there are a number of tests that just aren't reported to us. Those total numbers, all of the positives are reported to us, and like Mayor Nelson absolutely correctly said, many of the negatives just aren't reported to us because that information is communicated directly to the patient, and so many times public health doesn't need to be involved in the negative results.
And what is the status of testing healthcare workers across the city? I know Dr. Moad talked about that today, but for the rest of the healthcare workers?
I can start there and simply say that number one, at BSA, I think Dr. Weiss and Dr. Moad have probably also had a couple of these opportunities where folks have come forward and said, look, we have a antibody testing platform we'd like you to potentially consider for your employees. And I know that at BSA, we're going to fairly soon have the ability to do antibody testing. But the problem with the antibody testing is we don't know what to do with that information. For me to sit there and tell someone that, your IgG, which is the antibody response that suggests you were affected more remotely, is giving you some type of protection, it most likely is, but to what degree, for how long, how robust is that antibody response? We just don't know enough about it yet. So again, any staff member that has symptoms, we test with the PCR testing. Do you have disease or not? And then we get down our protocols as far as how we quarantine them and get them to return to work when they're now felt to be disease-free. But as far as folks that are asymptomatic, that have no other reason to be tested other than just to know if they have antibodies, we can do that testing. You've all heard about the false negative rates in the primary antibody test. And in the IgG test, again, what do we do with that information? So it's a battle that I think the nation's dealing with, and we're also dealing with it locally in terms of deciding what the ultimate best plan will be as far as testing healthcare workers.
And I completely agree with what Dr. Lamentier said. We have only been doing symptom-driven testing on our staff. And thankfully, the vast majority of times that's negative. We have had to clarify for our staff that if they go to one of these Walmart testing sites, if they test positive, they will be quarantined just as if they tested positive at our facility. So, and then what Dr. Lamentier said about the antibodies, we agree. I mean, it's just what to do with that information. And I know some of them are testing IgM antibodies too. And that's really the quick antibodies raised by the body in an infection. And the question is, if someone comes back IgM positive, do we have to quarantine them as if they were a positive based on the PCR test? So a lot of outstanding questions on how to use this data properly to help keep people safe and address the infection. And
to answer Ms. Martinez's question, actually, of course, we test symptomatic employees, but also we did asymptomatic testing for our CLC, which is Community Living Center, which is our nursing home inside of the VA. We tested all of our employees. As of right now, we tested all of our employees in the nursing home, not in the facility. As of right now, we have only one positive staff member that is quarantined at her home. But also, I like to share that we received a memorandum from our central office to enhance asymptomatic testing to other groups of employees and to test more and do more asymptomatic testing. And we looked at it and we have a strategy. I think we're going to test more staff members who work with immunocompromised patients, like chemotherapy patients, to make sure that none of them are carriers of the virus while they are working with this group of patients. Again, we use preventative strategies like wearing masks and all of that, but we have a plan to enhance asymptomatic employees as well to protect our patients.
And this one's probably for Casey. We've heard people having to wait a few days to get an appointment at the drive-through testing site. So I was wondering how that process is working now.
I've not heard that. I can certainly look into it. But right now, the way that the drive-through testing for Amarillo Public Health happens is you call 378-6300, and it's a same-day appointment. The testing center runs from 9 a.m. to 3 p.m. So if if you're outside of those times or on a weekend, you may need to wait. It's only Monday through Friday, so I can certainly look into that. I appreciate those questions. I can look into it, but right now those are the times, and it's certainly same-day appointments.
Thank you, Casey. And who is paying for the testing of residents and staff in senior living facilities, and do we know about how much it will cost?
So that order has come down from the governor, and so that the testing we've been told that the testing will be supported by the state, and so will be the tests that are being funneled through the public health orders that are being couriered by the fire department. We will pay for that through this money that is coming down through the state.
And last one, we heard we were getting 11 more cases of remdesivir to the area. We were just wondering how many patients that could help, or if that was coming.
See, that'd be news to us. We have not heard any kind of further allocation at this point.
I spoke a little bit with some state representatives this week, and BSA is being allocated some remdesivir, but not that quantity you mentioned. It's a smaller quantity. And I think some of the communication and work with Dr. Milton, talking with some of our state representatives and sharing information regarding numbers of cases has helped get us a little bit more, but I think we just got that in-house yesterday, and we're working with Dr. Milton and some protocols that we're putting in place as really a scarce resource allocation to decide who gets the drug, because we anticipate more people needing the drug than we have available.
Perfect. That's all I have. Thank you, guys.
Thank you, Ariana. This time we want to welcome a new member of our media to our news conferences, Paola Albaran of Telemundo Channel 10. How are you? Paola Albaran, how are you? Let's try one more time. Paola Albaran of Telemundo News Channel 10. How are you? I think we have.
Good morning. Good morning. Can you hear me now?
Yes, we can. How are you?
Good. Thank you very much. My first question is regarding Tyson. Are city health officials going to be checking in on Tyson to make sure they're following the recommendations they receive from the CDC, especially now that less workers are in the plant?
Yes, so we work with Tyson regularly. We have lots of communication with them, and so yes, we will certainly be doing that. We appreciate that question. So yes.
And regarding Tyson as well, what are you guys going to do? You know, we know there are like 1,500 employees that tested positive. When they can go back to work, is it after they finish their quarantine, or do they have to get tested again and be negative in order to go back to work?
So for anyone who is positive, the way we at the health department release people to go back to work is we require 14 days of from the date of their test result, and then they have to be symptom-free for at least 72 hours. And so it's a minimum of 14 days, but sometimes it's a little longer depending on if someone is symptomatic for longer than their 14 days. So generally it's around 14 days. And we have a team of people at Public Health who call each of the patients every day and monitor their symptoms. And so we're keeping an eye on that and working with each of the team members. And then Tyson is also kind of helping to case manage each of their team members as well. So we're working with the plant and the employees as well. We want to make sure that people are symptom-free when they go back to work, just like with anyone who tests positive.
Okay, perfect. And my last question is very similar to Ariana's question about the remdesivir. I am wondering if Amarillo hospitals have started to use remdesivir on patients, and if so, has there been any progress in terms of the patient's recovery or overall health?
So, as I stated previously, we've used the remdesivir on 3 patients at Northwest thus far, and one of those individuals was in respiratory failure, and she was able to come off the ventilator. And the 2 others are receiving the drug as of right now and are not requiring a ventilator, but we're monitoring them closely.
Okay, thank you very much.
I will speak about the VA. We had 2 patients in-house, and we treated them with remdesivir, and both of them were discharged. I think their length of stay at the hospital was shortened due to remdesivir. They got better quickly, and their clinical course was changed for better due to remdesivir. The way we get remdesivir to our veterans is very easy. Once they meet criteria, if they are admitted to the hospital, we enter their information to a portal, and then we get the shipment of remdesivir immediately in the mail.
Thank you very much.
Thank you, Paula. At this time, that concludes our Wednesday news conference on the latest information on COVID-19 and COVID updates. Once again, we do these every Monday, Wednesday, and Friday at 11 a.m. This is David Henry. I'm the Communications Manager for the City of Amarillo. And I want to thank our panelists for taking the time to join us today. We will see everybody on Friday. Thank you.
Thank you. Goodbye.
Bye.